The process of discovery. And in this, the patient engagement with the process is equally important to me as their susceptibility. Because I'll never treat two patients who are identical the same way. I mean, it's impossible. There's too much genetics, there's too much history, there's too much anatomy, there's too much individual aspects to it. So, this is pretty much the present understanding. Now, I qualify that because next week we may think something else. I certainly didn't think this 45 years ago when I finished my second residency. So, it's a chronic destructive bone disease. It's not a gum disease. And it's most similar in the human condition to those unfortunate folks who experience rheumatoid arthritis. Now, it's genetically modulated, which means that it's influenced by the genetics. How many of your patients have you seen in clinical settings who, I mean, you look at them and you say, the first thing I got to do is introduce them to the fuzzy end of the toothbrush. Okay? I mean, obviously they're using the smooth end. I mean, you know. And you clean it all, you know, you go through your wonderful care and everything, and they don't have any periodontal. And then you see someone else who's really making an effort within the scheme of what they already know. And their personal hygiene is awesome. And you start measuring pockets. And you look on the radiographs, and they've got 30 and 40% bone loss, and they're 29 years old. What's that about? Well, I think that what we're looking at is a dysfunctional, excessive inflammatory response with or without attendant gingivitis that's driven by an element of genetics very hard. Now, there are other variables. I mean, this meeting's about a lot of those variables. One of the variables is airway. One of the other variables is diet. And one of the variables is the nature of the bacterial invasion. Is it all in the biofilm? I think the majority of it is, but Dr. Neighbors presented that the whole microbial invasion is part of the equation. And that's the first time I've heard some real credible information about culturing. We cultured and nothing was different. We'd prescribe an antibiotic and, you know, in 3 months they were back in trouble based on the culture for years. So the patient is expecting gum problems. They need to know that it's much more than that. Now, this is what I got out of the lecture from Dr. Costerton. This was his article that was published several years later. I think it's the only really good article on perio in the ADA journal. The rest of it, unfortunately, is kind of misleading. So, they have a biofilm infection. Those pathogens, and Dr. Costerton estimated at least 90% of the pathogens are on proximal surfaces and proximal line angles. So, when patients learn that helps them understand why we're getting interested in flossing. I say the bad critters are bacteria, the bad critters are where you floss. We've got to deal with them. They're causing your bone loss. They're responsible for this infection. And I say, now, this is kind of a sticky film, and they're protected within it. You know, it'd be like pouring water through motor oil. My wife taught me the concept of prior knowledge. She's a PhD educator. Kids learn without that. They don't have any prior knowledge. They're like blank iPads. But adults have all this experience. And if you can connect a previous experience or previous knowledge with what you're trying to share, they're going to connect more easily. And it works. It really does work. So I talk about that stuff. I talk about the film being as resistant as motor oil. I tell them that if antibodies can't get in and your mouthwash and your toothpaste are not therapeutic in any way possible, well, how did your hot dog and spaghetti get in there? So they're not waiting for you to eat. Food debris is about cavities and personal hygiene. Have you had any cavities recently? Let's say they're 48. I say, well, I haven't had one since I was in college, and I had 2. I had some as a kid. I said, all right, and I observe that your personal hygiene is quite good. So you have had 2 missions in your oral care. I'm going to introduce you to a third one that I think will really open some doors to you becoming healthier. So, the biofilm is really gooey. and because it is, it's also adherent to the tube. Okay? Now, something else that's hard to remove, and y'all there this morning heard this, is cooking oil that's spilled on a kitchen counter. And I say to the patient with a grin on my face, I haven't met a patient yet who cleans up cooking oil with wax paper. Would you ever think of that? And they know I'm messing with them. They know I'm joking around. But you know what they remember when they come back is that silly analogy. Okay? I know now why I'm using unwaxed floss. Okay. So, if the bacteria recover, let's say in 10 hours, in the absence of food, that's arbitrary, and the patient doesn't want me to show up in a little bite truck every 10 or 12 hours, and I acknowledge that with patients every once in a while. You don't want me to show up. I mean, sooner or later, you're either going to get a shotgun or a big dog. And so who has to be the primary therapist for a disease that's ongoing and fed that frequently, at least twice a day? I mean, isn't that a logical conclusion? I can't treat their disease. I can help them treat their disease. My team is amazing. Now, I tell them that since I regard them as a person, unique, special, capable, I am feeling a sense of privilege to offer to help them. So they know where I'm coming from. And this is in the first discussion with them. The other thing that I share is, I bet there have been times when you've heard a statement that sounded critical. Because I was trained to be critical of patients who didn't take care of their mouths. There are at least a few hygienists who have had that training. And I say, they have a heart for you. They're trying to do their best. But they've been taught to communicate it as criticism and judgmentalism. Well, I want you to know, I only have one rule. No one who comes to me for help is ever allowed to feel guilty. That's just the rule. We do grace every time. We never do guilt. We will never criticize. We never come across that you're not living up to it, you're not healing fast enough, you're not doing all you can do. So I'm going to exhibit whatever patience is necessary, as my team will, for you to start to succeed. And people succeed at different rates. I only ask you to be patient with the learning, because this is not a quick learn. We have yet to run into a natural flosser. Okay, it's not intuitive. So this is the outcome that I alluded to in the introduction. If you can get it healthy and you don't keep it healthy, is that acceptable? It wasn't to me. I'm sure it isn't to any of you. So we've got to keep it sustainable. Well, their susceptibility to the inflammatory disease didn't go away, even though they became rather healthy. If they give it up, it comes back. They know that. Okay,